what spiritual practice and how it gets incorporated in the therapy program?
Yes, I prefer to think of this and to help people to understand what is really meant by the spiritual component, because there's so many misunderstandings, so many presumptions about what that means. First thing is it does not mean anything to do with religion. And what I define our therapeutic model as is transpersonal therapy. Now, that means that our therapeutic model includes the elements of the human being that is that sense of more than something more than just the body, more than just the conditioned thinking, more than just the ordinary emotions. Carl Jung described this as the numinous dimension. And so those that study more traditional psychotherapeutic models will recognise that phrase from Jungian psychology, the numinous dimension. So we're talking about the aspects of the mind that are not conditioned by the young conditioning of life or life's experiences. And this is the way in which people can get out of the trap of their negative thoughts, those thoughts that a man has, perhaps, I bet I'm not going to get an erection, or I bet I'm going to ejaculate too soon, or a woman, I don't think I'm attractive enough. Those thoughts come from external images that become concepts in mainly the left hemisphere of the brain. There's so much more to the brain than just where those concepts are locked. I think it is now common scientific and therapeutic understanding that we only utilise about 5% of the brain. There is so much more to the brain than just those concepts, and it's a transpersonal therapeutic approach that can help one to open the other neurological pathways in their brain. And therefore, the way this works in therapeutic recovery, if I can illustrate it like this, somebody's conditioning might have been very traumatic. They may have had a very troubled, painful background. Well, those circumstances are illustratively, if you like, stuck like this. Nothing can happen to dismantle them. They happened. Now, working with ordinary psychological therapeutic models, one recognises that their consciousness is also at the same level. And ordinary traditional psychology can only help people to come to terms with that. Transpersonal therapy can't do anything about this, but can do an awful lot about this. By raising or helping people to raise their consciousness, then these past events are still there historically, but they no longer trap the individual or his thoughts or his bodily reactions, because his consciousness now is operating at this level. So transpersonal therapy, in addition to traditional therapeutic modalities, helps the client to raise his levels of consciousness. There are higher levels of consciousness. So through simple practices of self-observation, for example, of observing one's negative thoughts and choosing not to identify with them, other practices such as simple meditation practices, or developing true concentration that helps one's self-awareness, different breathing exercises. These are the tools of transpersonal therapy. Now, some people may call that a spiritual component. I call it the transpersonal, beyond the conditioned, limited personality, helping the individual to explore the potential that exists there in the human psyche.